Welcome to Drug of the Week, presented by the Book Podcaster. This week, we're diving into something really common, a medication probably a lot of you listening have encountered, maybe personally, maybe through family or patients.
Yeah, it's definitely one of those cornerstone drugs.
Exactly. And it's metoprolol. That's Metoprolol. You might know it as low pressure or Toprol XL.
hmm Or maybe the newer Capspargo sprinkle formulation.
Right. And it's a beta blocker, mostly for heart stuff, blood pressure conditions.
Yeah.
Knowing this one is pretty key for safe, informed care, wouldn't you say?
Or absolutely. Understanding how it works is fundamental. So basically, metoprolol's main job is blocking certain switches in your body, specifically beta-1 adrenergic receptors.
Okay, beta 1 receptors. Think of them like docking stations for stress hormones, like adrenaline.
That's a great way to put it, yeah.
Hmm.
And by blocking those, especially the ones in the heart.
It tells the heart to just kind of chill out, slow down a bit.
Precisely. Slows the heart rate, reduces how forcefully it contracts, and that directly helps lower blood pressure. Now, our source material points out that at typical doses, it's pretty selective for those beta-1 receptors.
Which are mostly in the heart, you said, so it doesn't mess too much with other parts like the lungs. That's the cardioselective part.
Exactly. Beta-2 receptors are more common in the lungs, for instance. So ideally, it avoids triggering problems there, like in asthma.
Ideally, is there a catch?
Well, yeah, the source is clear on this. That selectivity, the focus on beta-1, can be lost if you're taking higher doses.
Ah, so at higher doses, it might start hitting those beta 2 receptors too,
Yeah.
potentially causing lung issues then.
It could, yes. That's a really important nuance to remember.
Got it. So, okay, the main effects are lower blood pressure, slower heart rate.
Yeah.
What else? You mentioned angina.
Right. It helps reduce the frequency of angina attacks, the chest pain from poor blood flow to the heart. And a really big one, especially highlighted for the Toprol XL version, is its role in heart failure.
Oh, how so?
It's been shown to significantly cut down on hospitalizations and, importantly, the risk of death for patients who have stable symptomatic heart failure. That's huge.
Wow, yeah, that's more than just managing symptoms. That's changing outcomes.
Hmm.
So the main reasons a doctor would prescribe it are pretty clear then.
Yeah, the indicated uses are hypertension, high blood pressure, angina pectoris,
Yep.
preventing another heart attack, so improving survival after an MI.
MI being myocardial infarction, a heart attack.
Right. And like we just said, managing that stable heart failure, specifically with the extended release Toprol XL.
Okay, standard beta blocker stuff. But I saw the source mention some unlabeled uses, things it might be used for, but aren't the main approved reasons.
Yeah, this is where it gets interesting. It shows how these drugs can affect more than just the heart. The source lists things like certain types of fast heartbeats, trying to prevent migraines.
Prevent migraines. Wow.
Yeah, prophylaxis. Also, essential tremor, that shaky movement some people get.
Hmm.
Even things like helping manage aggressive behavior, or a side effect from other drugs called akathisia, that awful restless feeling, and anxiety, too.
Anxiety. A heart drug for anxiety. How does that work?
Well, it's likely related to beta receptors also being in the nervous system, or maybe just by calming the physical symptoms of anxiety, like a racing heart, which can kind of feed the anxiety itself.
Huh. Fascinating how connected it all is. Okay, so you take the pill. What happens next? How does the body handle it? Pharmacokinetics.
Right. So you take it orally, it gets absorbed pretty well into your blood, then it travels around, and importantly, the source notes, it does cross the blood-brain barrier.
Ah, which links back to those neurological things like tremor or anxiety effects we just talked about.
Exactly. And it also crosses the placenta in pregnancy and gets into breast milk. We'll need to circle back to what that means for safety later.
Okay, and breaking it down, getting rid of it.
That's mostly the liver's job. And here's a really key point from the source. A specific enzyme, CYP2D6, does a lot of the heavy lifting
CYP2D6, why is that one special?
because of genetics. The gene for making CYP2D6 varies a lot between people. It's called genetic polymorphism.
Meaning some people's enzyme works differently, slower maybe?
Precisely. The source mentions about 7% of people might be poor metabolizers. Their CYP2D6 enzyme just doesn't break down metoprolol very well.
And the result for them?
The drug hangs around much longer, reaches way higher levels in their blood compared to normal metabolizers,
Mm-hmm.
and that significantly boosts their risk of side effects.
Wow, so the same dose could be way stronger for them. That explains a lot about why people react differently.
It really does. The typical half-life is listed as 3 to 7 hours, but that range is clearly influenced by this genetic factor.
Super important insight. Okay, what about timing? When does it kick in? How long does it last? Depends on the form.
Right. If you take the regular immediate relief tablet, it starts working pretty quickly, maybe 15 minutes, lasts about 6 to 12 hours.
And the long-acting ones, Toprol XL, Capspargo.
Yeah, the extended release forms. Onset isn't specified, but the peak effect is later, like 6 to 12 hours in, and they're designed to last a full 24 hours. That's why they're usually a once-a-day dose.
Makes sense. And if it's given IV in the hospital?
Oh, that's immediate. Starts working right away. Peak effect in about 20 minutes, lasts maybe 5 to 8 hours. But an important point for long-term use. The source says it might take up to a week of taking it regularly to see the full blood pressure lowering effect.
A whole week for the max effect. Good
Hmm.
to know. And here's something else that caught my eye about the effect can last for weeks after you stop.
Isn't that surprising? The source mentions the hypotensive, the blood pressure lowering effect, can actually linger for up to 4 weeks after stopping the drug.
4 weeks. That's
Yeah.
huge. Definitely something to keep in mind if someone stops taking it. Okay, so we know how it works. Who should absolutely not take it? Contraindications.
Yeah, the definite no-goes.
These are mainly serious, unstable heart situations. Things like uncompensated heart failure, where the heart's really struggling to keep up fluid in the lungs, pulmonary edema, cardiogenic shock.
Where the heart just can't pump enough blood.
Right. Or if your heart rate is already dangerously slow, what we call bradycardia, or you have certain types of heart block unless you have a pacemaker, giving metoprolol then could be really dangerous.
Makes sense. Don't slow down a heart that's already too slow or failing hard. What about situations where you need to be careful? The cautions.
There's a longer list here. Kidney or liver problems because the body might not clear the drug well. Lung diseases like asthma or COPD, remember that loss of beta-1 selectivity at higher doses.
Right, it could potentially trigger breathing problems.
Exactly. Diabetes is a big one.
Why diabetes specifically?
Because metoprolol can hide or mask many of the usual warning signs of low blood sugar, hypoglycemia, like the shakiness, the fast heartbeat. You might not feel those.
Oh, wow. That could be really dangerous if you don't realize your sugar is crashing. It could. But, and the source makes a point of this, it generally does not mask sweating.
So sweating becomes like the key warning sign for a diabetic on metoprolol.
It can be, yeah. A really crucial symptom to pay attention to. Also, caution with thyroid issues, as it can mask signs of an overactive thyroid too.
What else? Allergies.
Yes, if you have a history of severe allergic reactions, beta blockers might make those reactions worse, and they could also make epinephrine, the EpiPen stuff, less effective in treating them.
That's critical info.
And one more specific one, untreated pheochromocytoma, that rare adrenal tumor.
Hmm.
You have to use an alpha blocker first before starting metoprolol to avoid a massive blood pressure spike.
Got it. What about specific groups? Pregnancy, breastfeeding, kids, older adults?
Caution all around. Pregnancy,
Uh-huh.
only if the benefit clearly outweighs the risk to the fetus. Breastfeeding. Similar calculation because some gets into the milk. The baby could potentially have a slow heart rate, maybe some GI issues, dryness.
And that risk might be higher for those poor metabolizer moms.
Good point. Yes, the source suggests that's possible, as more drug might pass into the milk. For kids, safety isn't established below certain ages, depends on the form, but generally not for young children.
And older adults.
Often more sensitive, because you need to start with a lower dose.
Okay, quite a list of things to watch out for. So what about actual side effects people might feel? Adverse reactions.
Yeah, the source lists a whole range.
Right.
Cardiovascular ones are obviously key. Bradycardia, that slow heart rate, is often bolded as serious heart block, maybe worsening heart failure symptoms initially, low blood pressure causing dizziness.
The expected stuff from slowing the heart?
Right. But also decreased circulation to hands and feet, making them feel cold. Then there's the nervous system stuff. Fatigue and weakness are really common. Dizziness, drowsiness too. Some people might get anxiety, depression, even nightmares.
Wow, nightmare.
Yeah, it's listed. GI issues can pop up: constipation, diarrhea, nausea, skin rashes, even things like joint pain or, less commonly, erectile dysfunction. It's a wide net.
Really underscores needing to tell your doctor about any new symptoms and interactions. Beta blockers are famous for interactions, right?
Oh yeah, absolutely critical. Combining metoprolol with other drugs that also slow the heart or decrease its pumping strength is a big one. Think certain calcium channel blockers like verapamil or diltiazem or digoxin, even general anesthesia. The effects can add up dangerously.
So stacking up the braking effect on the heart.
Exactly. And mixing it with other blood pressure meds or nitrates or even alcohol can lead to too low blood pressure. But one interaction you really need to highlight is with stimulants.
Stimulants, like caffeine or something stronger.
Stronger stuff mainly, amphetamines, cocaine, but also things found in over-the-counter cold meds like pseudoephedrine or phenylephrine and epinephrine itself.
Okay, what happens there? This sounds important, especially the cold meds part.
It is, because metoprolol blocks the beta affects the heart speeding up. Some blood vessels relaxing the alpha effects of the stimulant are left unopposed.
And alpha effects tend to constrict blood vessels.
Right. So you can get this paradoxical, really dangerous increase in blood pressure, potentially extreme hypertension. And because the beta-1 block on the heart is still there, you might have that high blood pressure with a slow pulse. It's a bad combination.
Yikes. High BP and slow heart rate. That sounds really serious. Everyone on metoprolol needs to know about checking cold medicine labels.
Absolutely vital. And it can interact other ways too, maybe making thyroid meds less effective, messing with insulin or diabetes pill requirements, reducing how well theophylline works for breathing. And don't mix with MAO inhibitors, those older antidepressants. Big risk of hypertensive crisis.
The takeaway really is, tell your doctor and pharmacist everything you take, period.
Couldn't say it better myself.
Okay, let's get practical. How do you actually take this stuff? Forms, instructions?
Comes as regular tablets, extended release tablets, those extended release sprinkle capsules, and an injection for hospital use. Big point. Metoprolol tartrate is usually the immediate release, and metoprolol succinate is the extended release, like Toprol XL. They're not the same dose-wise if you switch.
Not interchangeable. Good to know. How about taking the pills?
Generally, take the oral forms with food or right after eating. Helps absorption, maybe less stomach upset. For the extended release tablets, like Toprol XL, you can often split them if scored, but never crush or chew them.
Because that breaks the time release feature.
Exactly. Wrecks the whole point. For the Capspargo sprinkle capsules, you can swallow them whole or open them and sprinkle the beads on a small amount of soft food, applesauce, yogurt. But you got to eat that mix right away, within 60 minutes. Don't save it.
Okay. And the IV form, you mentioned it needs special care.
Yeah, it's labeled high alert, high risk for errors causing harm. The force warns about mix-ups with similar-sounding drug names, like Toprol XL versus Topamax, or Lopressor versus Lyrica, or even confusing the tartrate and succinate forms FOIV. Needs careful checking.
Makes sense for a potent IV heart drug. And before giving any dose, especially oral, there's a key check.
Crucial safety step. Check the apical pulse. Listen right over the heart. If it's below 50 beats per minute or really irregular, you hold the dose and call the doctor. Don't want to push a slow heart rate even lower.
Absolutely fundamental. Okay, let's pull this all together for someone taking metoprolol. What are the must-know patient teaching points from the source?
Write the take-home messages. Number 1, take it exactly as prescribed, same time each day, don't skip doses, and never stop suddenly.
Why is stopping suddenly so bad?
The source warns it can cause life-threatening problems.
Yeah.
Dangerous heart rhythms, a big spike in blood pressure, even trigger a heart attack. You need to taper off slowly under medical supervision if you need to stop.
Okay, never stop abruptly. What else?
Learn how to check your own pulse and blood pressure. Report big changes. Be careful with driving or tasks needing alertness until you know how it affects you. It can cause drowsiness or dizziness.
Right, the dizziness.
Yeah, so change position, slowly sitting to standing, lying to sitting, to avoid getting lightheaded. That's orthostatic hypotension. Also, you might feel colder, especially hands and feet.
And the interaction message again.
Huge. Tell every healthcare provider about all meds prescriptions, OTC, herbs, vitamins. Don't start anything new, especially cold meds or stuff with caffeine, without asking your doctor first.
And the diabetes point, one more time?
Yes. Monitor blood sugar super closely. Remember, most low sugar signs might be hidden, except sweating. Sweating means check your sugar, stat.
Okay. What symptoms mean call the doctor right away?
Red flags include pulse getting really slow, trouble breathing or wheezing, feeling severely dizzy or like you might faint, confusion, depression, seeing a rash, getting a fever or sore throat, or any unusual bleeding or bruising.
Got it. Any final tips for patients?
Let doctors and dentists know you're on it before any procedures or surgery. Maybe carry an ID card listing your meds and conditions. And if it's for blood pressure, remember it controlled it, doesn't cure it. Lifestyle changes, diet, exercise, stress management are still totally essential.
That's incredibly helpful, practical advice, grounded right in the drug information. It really demystifies it.
That's the aim. Take all that detailed info and make it usable. Make it something that helps you feel empowered and knowledgeable about your health or the health of someone you care for.
So, We've gone from how it works at the receptor level, how the body handles it, the genetic quirks, who needs to be careful, side effects, those crucial interactions, how to take it, right down to what you absolutely need to know as a patient. It's amazing how much there is to unpack for even a really common drug.
It really is. Shows you they're complex tools.
So here's a thought to leave you with, based on everything we've discussed. Given metoprolol's specific action, but also its wide-ranging effects, interactions, and even how our own genetics play a role, how does this deep dive make you think differently about maybe even the pills you see every day, and why truly understanding them matters so much?
Something to definitely ponder.
Well, that's our deep dive on metoprolol for this week's Drug of the Week. Hope you found it useful.
Yeah, hope it helps clarify things.
Don't forget to like and subscribe and maybe leave a comment if you found this useful or if there's a drug you'd like to see featured. We'll catch you on next week's breakdown.